We refer to ourselves as an organism, an organized group of cells that work together so that we can express life as one symphonic whole of cells. The individual cells actually work together in coordination as a result of a master control system, the nervous system, bringing those cells together to work in concert with each other. Think about the number of different functions you have in your body and the specific types of cells that have to work to digest your food, to allow for circulation to happen of the blood in your body, to allow you to move, allow you to sense all the things around you through hearing, sight, taste, touch. These are all specialized cells that work together, bringing information through the spinal nerves, up through the spinal cord to the brain, allowing the brain to assimilate that information and bringing it back down through to the body so the body can respond to whatever it is that's around it. It is so miraculous and so intricate the way that all of this functions. And yet, because we day to day use our bodies so regularly, we take this very much for granted.
I was in pain, and you get a crick in the neck or something, and not know what to do with it, so it slowed you down. He changed me. He made me well. I don't have the aches and pains anymore, and I just always feel good. Well, I've been coming for how many years? A good number of years.
There are 3 levels of care in chiropractic. People understand and are familiar with the first level of care, which is the pain relief or intensive phase of care. In that phase, the person is suffering and actually has a great deal of inflammation and spinal rigidity. The care rendered at that point is for the purpose of taking the pressure off the neurological tissue within the spine by reducing the inflammation and the rigidity within the spinal structure. As the nerves become more at ease, the person notices that they're making progress. Then they feel noticeable improvement, and ultimately their symptoms go away. When that happens, the person comes to the beginning of the second phase of care, the corrective phase of care. The uninformed person at that point says, "I feel great," and makes the decision to stop care. This actually causes them over time to potentially go into relapse, where since there was no correction made to allow for stabilization of the ligaments and muscles that support the spinal structure, the spine begins to redistort until ultimately the spine becomes so damaged and distorted again, the nerve tissue becomes irritated and the person begins to experience symptoms again. Each time the person goes into relapse, the condition becomes more intensified until finally a pain that was localized to the low back, as an example, starts to radiate into the buttock and ultimately the leg region, ultimately leading possibly to surgical intervention. The informed person, on the other hand, understands that there are 2 further phases of care to pursue and to go through. The corrective phase of care is the most important phase of care because during that phase of care, the spinal structure is moving towards stabilization in a normal, healthy, neutral, symmetrical state, the state that the person was born in. Each time that we adjust an individual in this phase of care, there's a building process that occurs where the spine is repairing itself. Muscles and ligaments are strengthening. The spine is stabilizing. Discs are becoming healthier again. And as a result of that, the spinal structure takes on more and more stability until we attain the most stability we can for that particular individual's condition. When that happens, then the person is in the 3rd phase of care, the wellness phase, where they come in very infrequently with enough regularity to maintain the integrity of the spine that we've created, keep the person out of the relapse phases that would otherwise ensue, and allow the person to be more adaptable, more functional, more expressive of a fuller potential for healthy life.